Practicality dictates that everyone's results will vary as well, as we are all unique and different. Basically, it's going to take hard work to make a substantial amount of income in this business. Some people will make no money at all. The earnings of an Epic MD virtual care consultant will be 100% dependent upon their skills, their work ethic, effort, commitment, leadership capabilities, and market conditions. Common sense would suggest that in most opportunities, one would find exceptional individuals performing well above average, while others perform under average. The Epic MD does not guarantee any level of income or your success. This does not account for any business expenses that one might incur while building a business.
And I want to get into the Epic opportunity. Okay, a lot of people get involved in this business and they do it on a spare time, part-time basis. We're not looking for you to quit your day job. We're looking for you to put forth, this is another source of income in most cases. It's called supplemental income. Okay, let me ask you a question. What would an extra $3,000 to $5,000 a month mean for you? See, what would it mean for you to be able to own your own business without the traditional overhead? What would it mean for you to have lifestyle control and take advantage of the same tax advantages you get with any other business? The number one thing I believe we could get everybody here doing is earning what we call immediate income. I'm talking about earning money now. I'm talking about putting people on a business plan to make 6 figures their first year. But what would it mean to cover a car payment? You know, we were talking about Uber just a second ago. Have you seen the latest Uber commercial? Have you seen it? Here's what it is. Just picture this. It's a guy working 8 hours in his normal day job. He gets off, he turns on his Uber app. He works 4 hours and Uber pays daily. And that day he made $248, which allowed him to take his wife to a beautiful dinner. That's what they're marketing at Uber, to make an extra $248. So we know what it means to add extra income. Why Epic? Because telemedicine is the next $113 billion industry. We've identified a trend. We are going to change how healthcare is delivered. And there lies the opportunity. But how many of you have done what you've done for the last 10, 20, 30 years? You may feel stuck. You're looking for an advancement opportunity. You're looking for a way to be paid what you're worth. You don't like the glass ceiling. We give you that opportunity. But really, the key to our business is residual income. Every wealthy person knows what it is. And if you don't have it, you're not going to have time freedom. You're not going to have money freedom because you're trading time for dollars. Imagine earning a percentage every time a doctor sees a patient. Think about that concept. And what we are going to provide for you is a system that will buckle your knees. I'm talking about a proven system for success. How do I know it's proven? Because between myself and Lisa and Lou Gallardo, we got over 100 years of experience in this industry. That sounds kind of weird, huh? Okay. We look good though, don't we? We offer personal and group coaching. Okay. Turnkey programs. You're going to see our weekly calendar of events, social media platform. And how about this? All people on this call that maybe have ventured into other network marketing companies. How about this? A lead generation program for our top producers. How about that? Okay, actually receiving leads of people that want the information. So that's the Epic opportunity, guys. But what we're doing here is, guys, we are looking to deploy our product into the doctor practice. We want to disrupt the medical community, right? We have strong ancillary incomes for the physician. You know, some of you don't understand the physician world. I talked to a neurosurgeon today. Do you know what he told me? He said, you know the procedure I used to get $17,000 for, last week I got $600 for? You got to understand, this is a group of people that are looking to make more money, and we're going to help them do it. So let me tell you now the different ways we're going to be able to pay our virtual care consultant base. You hear what I said? Virtual care consultants, that's what we are. We're going to offer a 20% immediate income on all new virtual care specialists. We're going to pay through a uni-level compensation plan, and we're going to pay down guaranteed during the pre-launch through 5 generations. You're not going to have to qualify to get your 5 generations. You're automatically, during this time frame called our pre-launch, which will go between now and September 1st, we're going to pay through all 5 generations. For those people that really see the vision here, okay, and you excel into our compensation plan, we're going to offer tracking equity, car bonuses, founder bonuses, and luxury trips. People always say, I want to get involved in the beginning. Why? Because tracking equity is offered. Founders bonuses are being offered during this time frame. And it's going to be for those people, okay, that really understand the vision and have the ability of building their teams. So let's talk about that. You know, one of the things I love of Matt's vision is having fun. And so we're going to work hard and we're going to play hard. And we're going to go to unbelievable resorts all around the world. Okay, and we're going to be announcing our very first event to reward these people that perform during the pre-launch. Okay, it's going to be something that you're not going to want to miss. Okay, so let's talk about the different qualifications. Okay, and I just want to preface this. In order for someone to get involved in our company, okay, it's $749. Okay, see, I just now understand a slide I have to do before this now. See, this is why we do this. Okay, so here's how we do it. Everything we do is based on people joining our team. So the qualification it's going to take to get to our first rank, which is called manager, is by accumulating $10,000 in group volume in a calendar month. Knowing the people getting involved, it's $749. So you want to do some math? How many times does 749 go into 10,000? That's how many people your group has to bring in to get to the manager level. If you can't do it in 1 month, you could do 30,000 between now and September, a rolling 4 months. Clear? Executive, $50,000 in 1 month, $150,000 in a rolling 4 months. If you hit the executive level on a consistent basis, that qualifies you for our car bonus of $800 a month. Director is $100,000 in total business in 1 month, or $300,000 in a rolling 4 months. What happens if you hit the director level? Okay, you get the car bonus and the founder's bonus. Founder's bonus works like this. We're going to take a percentage of the company's profits, and we are going to be dispersing those profits to the people that have the founder's bonus. And we believe it can mean hundreds of thousands of dollars to be shared. Okay? Regional director is when you do $200,000 in 1 month or $600,000 in a rolling 4 months. Some companies make you do $200,000 in 1 week to hit these levels. We're allowing you to take 4 weeks or 4 months. If you get to the regional director, you get the car bonus, the founder's bonus, and equity shares, tracking equity in the entire company. This is something that's only offered, usually only during a pre-launch. National marketing director is $350,000 in 1 month, $1 million in total sales in a rolling 4 months. And now you've taken home everything that's been offered. Car bonus, founder's bonus, tracking equity, now listen, and a 2% infinity bonus that goes to the bottom of your organization. Imagine blanketing everything your business does down to infinity, an extra 2%. So those are the rankings that we are rolling out during this pre-launch that started, what day are we on? Friday.
It hasn't even been a week.
Okay, hasn't even been a week. This is how brand new this is. And we're going to go to August 30th during this pre-launch phase. Okay, now, what does that mean? Okay, this is where you got to follow me, guys. Stay with me. Okay, and I appreciate Matt being on, the CEO. Okay, it's a big deal for him to be on this call. Okay, don't expect him to be on all these calls. Okay, but you know what? This is a special time. So let me share with you. Okay, during this pre-launch, here's what we're doing. On every new package, which is $749, we have one pack. Why? We understand the value. $749, you get paid 20% automatically on every new package that comes in. It's $149.80. We pay every 2 weeks here. Direct deposit into your account. Every 2 weeks in immediate income. Yes. Yes. Well, was that okay? Yeah, it's immediate. Yeah. Okay. $749 times 20, $149.80. Now I'm going to show you all what you're going to have to do. And I'm talking to some of the people that have the ability, because everybody has always asked me in 25 years, Jeff, during a presentation, show me how to really get traction quick. If you're a leader, okay, if you could bring in 40 people, you will build momentum into your business. And people say, how long does it take me to get 40 people? I don't know. Can you do it in a week? Can you do it in a month? Worst case, can you do it between now and September? If you bring in 40 people, okay, you built the foundation that's going to start to get momentum. And you earned on these 40 people, $5,900. Take 40 times $149.80, and that's what you're gonna get. That's your immediate income just on the 40 people you sponsored. Now watch. We know out of 40 people, you're gonna have a couple of people that are also probably gonna do what you did. But let's just say out of the 40 people, everybody just got 3. That means on your second level, you have 120 people. You're making 10% on your second level. That means on your second level, you just earned, where's my glasses, $8,900 on your second level. Then those 120 people get their 3. That's 13,000. Those 360 just get 3. That's 32,000, and they get 3. That's $72,000. That's $133,000 in immediate income. You want to know why I'm showing this? This is exactly what Lisa and I did in the company we just exited. We did it in the first 3 months. We put together a team of 5,700 people. And we brought to the table 52. So I'm just showing you, okay, because some people go, I could do this. Okay, now watch this. This is where it gets fun. See, the first month someone gets involved, they're doing what? Their $749 package. The next month, they're going to also be a member of Epic MD Network. And they're going to also, with the membership for $49, right, going to be able to see their doctor for 24 hours a day, 7 days a week. Of course, every person building is going to also want to enjoy the benefits of the service. So the next month, all these people you just brought in, okay, they get on the $49. Now watch this. Now you're building residual income. Guys, I was in the health club field for 14 years. People buy a membership, they don't give it up. They keep paying that membership fee whether they come or not. I want you to understand this. So remember those 40 people you brought in? The next month, that meant to you $392 in residual income. The next level meant $588 in residual income. The next level, $862, $2,100, $40. You built, while you were building your distributor base, an $8,700 a month residual income. Most people in network marketing don't make that a month on their immediate income. But we're building the base, and then the base is getting on the membership. Okay? Now watch this. We haven't sponsored a doctor yet. We haven't helped a doctor deploy or put in the Epic MD program into their practice yet. But watch. You got 4,800 people on your team. Let's just say a third. I'm gonna mute you out, Lou. Sorry. Okay, a third of those people do nothing. A third do very little. Let's just say they do nothing, and you had a third of that 4,800 people go to work. Well, if you take a third of 4,800, that's 1,600 people you have going out there to do what? Find doctors that want to implement our program. Let's say out of that 1,600, they each got one. Everybody just got one doctor. This is what you have to get here, guys. This is something you've never seen before. Every doctor practice can equal 2,500 patients to you. 2,500 patients. So one equals 2,500. If you take 1,600 times the average practice with 2,500 patients, that's 4 million patients that are going to be exposed to this program. Who's doing the marketing? We are. Watch. Let's just say we had a 5%. We believe we could get it up to 30%. Let's just say we had a 5% conversion rate. That's 200,000 patients on $49 a month. You want to do some math? At the worst case scenario, you were making averagely 3%. Because you got to understand, some of these people are at 20%, some are at 10, some are at 4, because that's the different levels. Let's just say you got 3%, that's $248,000. I know this is going to blow you away. A month. If you had 200,000 patients on our $49 program, because that means you have a $10 million a month business, and take your percentages. This is something that people in network marketing can understand. One person maybe equals 4 to you because they talk to their family and friends. One doctor practice can mean 2,500 people. Okay? So it's very simple. When someone gets started, they get their package and they get on the membership for $49 a month. So you're going to be able to register and you're going to be able to see your doctor 24 hours a day, 7 days a week. You need a prescription, they could write you a prescription. You are now part of the Epic MD Network membership. Okay? But to take advantage of our pre-launch, okay, here's the thing I want you to understand. You have, for $749, it's $1,499. But during this pre-launch, it's 50% off, it's $749, which gives you the ability to have unlimited deployments in as many practices as you want. You got to understand, in our business, we're in a different world now. We're in a compliant world. It's called the medical world. There will be an Epic MD certification that you're going to have to go through very quickly to be certified to go out there, right, to be able to deploy a practice. We'll be providing that training. And you're going to be able to earn through all levels during this pre-launch. So if this is something that excites you, you need to get with the person that got you on this call, get the link, and start working our very simple program. Step 1, enroll. Get that done. Step 2, start sending out the Epic MD videos to your top 100 contacts. And step 3, get them on a follow-up 3-way call with one of your leadership, a recorded presentation like this has been recorded, or a live Zoom meeting, okay, with anybody that you have in your leadership upline. That's the next step. Get started, start sending out the information. That's all Lisa and I have done in the last 7 days. And look, just from doing that, at peak today, we had 147 people on this call. Okay, and that was 7 days worth of work. And now what you want to do is take advantage of the next time we're going to do this, which is Sunday night. Sunday night, and every Sunday, Tuesday, and Thursday at 6 o'clock Pacific time, we will be doing these live. We will also be doing many different types of 3-way calls, right? So all the different things you have. We will also have a 15-minute version recorded that you could send out to your prospects very quickly. So all this is being created for you. But you could mark it down, everybody. You were on the first Epic MD launch webinar. What you do with it is up to you. Okay? So this is a land grab opportunity because we're going to be aligning all the different physicians, okay, that want to implement our program, okay, all around the United States. And I'm going to have this question. We are only in the United States. But just think about the possibilities of what we can do together. You guys, once again, I don't know how I could stress it. We've never been more excited. We really believe that this is a great opportunity for those people. And Lisa and I are going to have a pledge to everybody. You take the journey, and you come 50% of the way, we will always come the other 50%. And together, we could all go out there and build our dynasty we've all been looking to build.